Our presentation today is there an association between CHF and ER visits? So the introduction, many studies have been done regarding congestive heart failure, what contributes to it, how to improve it, and even how to prevent it. There aren't plenty of studies on the relationship between congestive heart failure and ER visits, even though there are some disproving or proving the research question, they're really far and few in between, really hard to find. So the paper examines various articles dissecting every aspect surrounding congestive heart failure, all to answer the research question and find out the ways to reduce ER visits and encourage a more at-home based management program. So the literature review, we have cdc.gov and emoryhealthcare.org, and they kind of start us off by presenting some facts which transition into why CHF is so important to research and find more about. They really emphasize the tragedy of CHF with numbers such as 550,000 new cases being diagnosed every single year. And overall, there's around 6 million adults, exactly 5.7, who are suffering from CHF in the US alone. So that's a really high statistic for conditions such as this that's really preventable. And in the study conducted by Azad and LeMay, it was found that CHF is the leading cause of hospitalization for those over 65, and that other conditions such as hypertension and diabetes are both risk factors linked to heart failure. The study conducted by Mensah and Sawyer focused on demographic correlation to CHF in Tennessee, particularly because it's one of the states with the highest rates of obesity. So they picked it so they could kind of show the correlation between obesity, diabetes, and CHF. And it found that African American young males are most susceptible to CHF. This wasn't because of their skin color in particular, but just because of the fact that their lifestyle choices, such as diet, exercise, smoking, drinking, etc., whatever it may be, those were contributing to them getting diabetes, obesity, and hypertension. And then those three were really contributing more to the CHF. So it wasn't so much that they're African American that was causing the higher rate of CHF, it was the other health factors. And this information is relevant because it can be used to prevent future diagnoses of CHF by making healthier life choices. The study by Bosch and Wensing concluded that the primary form of treatment for CHF currently is a combination of the pharmaceutical route, so the medications. So we have angiotensins and B blockers, and then they mix those with guidelines for a healthier lifestyle. But they both could be improved on because, as it was stated in the paper, a lot of the problems stem from people that have really severe CHF are actually getting less treatment than people with less severe CHF. And that association hasn't been discovered yet as to why, but it is there. So that's a major problem. Another major problem is that only between 40 and 60% of patients reported getting clear lifestyle advice on how to live their life to the most healthiest aspect that they possibly can, when it really should be 100%, not 40 to 60. And then the study conducted by O'Brien studied whether hospital readmissions from CHF patients are necessary or if they're really preventable. And it was found that they are extremely preventable and they can be reduced if the hospital staff, so the nurses, the physicians, they need to have proper knowledge and training. So as far as diagnosing CHF goes, because sometimes it's incorrectly diagnosed and then they're just being readmitted for something that's probably just obesity related. And also it falls back on the patient because they need to follow the instructions of the doctor, because in the article it was reported that only around 50% of patients were actually doing what they were supposed to be doing as told by their doctor. So taking their medications every day at the proper time, with food, without food, etc., exercising, eating right, and so on. So methods. For the data analysis portion, the research question is there an association between gender and admission source from the emergency room? The null hypothesis is that there is no association between gender and emergency department admission source. Dataset. The dataset consists of number of patients, admission source, and gender. This data was used to calculate descriptive statistics with pivot tables, pie, and bar charts. Additionally, chi-square charts were performed. And the results, we have the pie chart, which is showing percentages of 45%, 36%, 11%, 5%, 2%, and 1%. For emergency room, physician referral, transfer from hospital, transfer from SNF, transfer from other healthcare facility, and clinic referral, respectively. The number of patients were 177, 141, 41, 20, 9, and 2 for emergency room. Physician referral, transfer from hospital, transfer from SNF, transfer from other healthcare facility, and clinic referral. And then the gender bar graph indicated male 198 and female 192 for the count of patients. And the chi-square test is currently pending. Conclusion. So the studies examined, they revealed a lot of interesting and useful findings. This included everything from demographics, so race, gender, African American males in particular, young African American males really being the most susceptible to eventually getting CHF or already having it. So this really pointed out that they need to be preventative now before they get it. So they need to start and maintain a healthier lifestyle to avoid getting CHF in the long run. And then it also revealed that patients and hospital staff need to really improve on their communication with the patient when they're discharged. So the discharge instructions really need to be clear and kind of like heavily implemented to really prevent readmission, because that's what we're trying to do, is reduce ER visits, reduce readmission, reduce costs, make it easier on everybody. And the guidelines need to be heavily reinforced to CHF patients as part of treatment. So referring back to the health guidelines and 40 to 60% of patients that they receive those, that needs to be 100%. And then preventing CHF includes preventing hypertension, obesity, and diabetes. So since we now know that hypertension, obesity, and diabetes are really what are risk factors that eventually contribute to CHF, we need to take a step back and try to see what we can do to prevent those things first so we don't even end up with CHF. So did the research answer the question? The research did answer the question, but the support could have been stronger. The amount of articles that had a correlation at all between CHF and ER visits was really, really thin. With the research provided, there is a clear answer to why CHF is so important and why so many people are readmitted to the hospital. It's a dangerous and common condition that must be stopped, which is why research comes in handy, because it teaches us a lot of things that we could do to prevent it in the future. Overall, CHF can be treated at home more frequently and help cut costs and time in general. Lastly, we have limitations. So the studies all had different limitations. However, the most common seemed to be the geographical problem. So a lot of the studies only studied one city, one town, one state in the whole country. So that kind of limited the amount of possibilities from participants that we could get. Also, the issue of sample size, as each study had a limited number of participants. This creates an issue for application to reality, because a sample size of 25 nursing homes, for example, in the O'Brien study, that doesn't represent all the nursing homes in the country, so it really wasn't generalizable to real life scenarios. And lastly, limited data collection methods were used. If more methods were implemented in each study, the depth of findings would have been substantial. So in every study, they could have used more data collection methods than they did, and the research would have been astounding. And there are the references, and that is it. Thank you so much.